Assalamu alaikum and welcome back to another episode of What's Up Doc. I'm your host, Dr. Ali Al-Barwani, and I'm a board certified physician. My show, What's Up Doc, is a production of Muslim Network TV, the only Muslim-focused network broadcasting in North America. You can watch us streaming nearly every day on Roku TV, Apple TV, Fire TV, and Galaxy 19. You can also find our episodes on our website at muslimnetwork.tv and on our YouTube page at youtube.com/Muslim Network TV. Today we're going to be talking about something that I'm fairly sure that all of us have experienced, and that is pain. With the advent of the opioid pandemic here in the United States, pain medicine has garnered a lot of attention, and that's the topic of our discussion today. Joining us in that discussion is Dr. Danish Ali. Dr. Ali is a Houston native and graduated from the University of Houston with honors. He obtained his medical degree from the University of North Texas Health Science Center in Dallas-Fort Worth, Texas. Concurrently in medical school, he obtained a certificate in public health. Dr. Ali furthered his medical education by specializing in physical medicine and rehabilitation at the University of Texas Dell Medical School within the Seton Brain and Spine Institute in Austin, Texas. Special interest in pain medicine led him to further subspecialize in pain management at the University of Texas Medical Branch with affiliation to the MD Anderson Cancer Center in Houston, Texas. Dr. Ali is active in and out of the medical community. He has presented in numerous medical conferences, and he's been featured in various news articles. He's also the medical correspondent for Fox 26 News, where he is regularly on TV discussing various current issues in the medical community. He's also active in training medical students and residents, serving as assistant professor for the Universities of Central Florida College of Medicine and the University of Houston. Welcome, Dr. Ali. It's such a pleasure to have you, and what an impressive background you have.
Thank you so much, Dr. Al-Barwani. I appreciate it. It's a pleasure to be here. I'm excited to talk about pain management, especially as you mentioned with the whole opioid crisis that we're dealing with. I'm looking forward to kind of chatting with you a little bit on some of the alternatives, what other things we have to offer, and I'm looking forward to the conversation.
Me too. You know, there has been a lot of bad attention, I want to say, maybe, in the field of pain medicine. It's really interesting to see kind of the movement that we've had from back when I started practicing medicine many years ago, where pain was considered the fifth vital sign, right? So we started including our blood pressure, our heart rate, our pulse, our temperature, our weight. We said, okay, we have to include pain now as this fifth vital sign, as something that we are not doing a good enough job of measuring and treating. And so we did. And then pendulum swung the other way, where now they're saying that we're over-treating pain, and we've created, collectively, physicians in treating pain medicine, arguably appropriately, inappropriately, have now created this, have contributed. I won't take all the responsibility, because Purdue and the Sacklers definitely have their part in this, but that we've contributed perhaps to what's going on with the crisis that we have in this country. And maybe it's not the best place to start, but that's one of the reasons that I thought it would be interesting to kind of shine a little bit of light, because there's definitely way more that you do in your day-to-day to really do a lot of good, to help people who are truly suffering from pain without creating or contributing to this crisis that I just mentioned. So I thought it was really good to have you on here. And I guess we'll take several steps back and start with explaining what is pain medicine for those who maybe have not heard of that term before.
Sure. Yeah. So pain medicine is having pain anywhere in your body, right? So if you've got pain, we all have different generators, different things that cause us to have pain. Sensory phenomenon, right? And so unless you have an actual accident where you have your limb chopped off, a lot of it has to be involved and has to do with the nervous system. And so pain is a sensory phenomenon, and oftentimes that's how it's treated as well. And so that's what pain medicine is. There is a subspecialty that that physicians go into to subspecialize in that, so they can help treat folks who are in pain. And there are different routes and different ways to get to that. Some of my anesthesia colleagues also subspecialize in pain. And then there's neurology, a small subset. And then there's folks like myself who have done their residency in physical medicine and rehabilitation, and they also further subspecialize in pain medicine.
That's great. Thank you for just kind of giving us a broad overview. Now, something that I left out of your pretty impressive resume is that you really take an approach to pain management, and the words you used were multidisciplinary and comprehensive approach. And, I can relate to what you mean by that because I've worked with pain medicine specialists, but for those who that's just kind of broad jargon, walk us through what that means, because I think for a lot of patients, when they hear the words pain medicine or pain management, they automatically think that I'm trying to put them on hook them onto substances like narcotics that they will have to rely on and be addicted to really for the rest of their lives. And that's not always what I mean. And actually that's never what I mean. I'm never trying to hook anybody to anything that could be potentially detrimental to their health in the longer term. So walk us through, when you use that word, what you mean and what you offer your patients.
So again, pain is treated by a facet of different ways, right? There's not just one simple thing that will fix most of the cases, right? There's not just one thing that you can do that will get rid of quote unquote pain, right? What we call, there's pain generators. So pain generators are what is causing the pain, right? That's what I like to call as the driver. And then there's secondary phenomena from whatever is generated by the primary, right? And so that would be the passenger in this analogy of a car, right? And so you've got the driver and you've got the passenger. So the driver is whatever thing it may be that's generating the pain, and then the secondary phenomenon is what's being affected by that, right? And so we often see one of the most common things that I treat in my practice is lower back pain. A lot of times that back pain is coming from arthritis. And so that's the driver, that's the primary generator of their pain. The passenger is the muscles that are affected. It's the limb pain, limb meaning the lower extremities, their legs being weak, numb, tingling, burning, that sort of stuff. That's the secondary generators. So our job in pain management is to be responsive to knowing what's the primary and what's the secondary, right? If we're going after the secondary, we're never going to get to the root of the problem, and we can never help them in the long run. Having said that, even to treat the primary issue, whatever it may be, and most of the times it is arthritis, you have to have a multidisciplinary approach. And what we mean by that is it's just not one thing that can often treat this etiology of pain. It's often multidisciplinary, which means that beyond just medications, there's also some lifestyle modifications that you have to do. And those lifestyle modifications may mean losing weight, stopping tobacco use, exercising on a daily basis, those sorts of lifestyle modifications. Then there's that bucket of medication management, right? Just because you're in pain doesn't mean that you're going to be getting these so-called narcotics, opioids, these bad medications. There are so many different sorts of medications that you can often be on and take that are nowhere near the pendulum of the opioids, the narcotics, the stuff that you want to avoid because of the addiction and the death and all that stuff. And those include muscle relaxers, right? So a lot of times this arthritis, the nerve pain will affect muscles. And so one of those things is muscle relaxers. A lot of those are on the market to help treat spasms and folks that are dealing with muscle tension. The other one is the neuropathic agents, right? So nerve pain medications. Those are medications that often treat nerve pain. So numbness, tingling, burning, that sharp pain that your leg gives out on. Those are those medications that can help treat that. And lastly, there's also arthritic medications that are NSAIDs, non-steroidal anti-inflammatory medications that can also decrease your inflammation and help reduce pain. A lot of these medications are not addictive. They're not responsible for this opioid pandemic. They're not responsible for all these deaths that we see. And so that's that medication, right? And again, in multidisciplinary, we're talking about all these little buckets that we have. And so the first we talked about lifestyle modifications. Next, we talked about medications. The third is therapy. Therapy is so important for folks to start doing exercises, start figuring out those muscles that have been inactive or not working for such a long time because either they've had a sedentary lifestyle or they haven't been participating in, whatever activities that they should be, i.e. walking, running, exercising, those sorts of things. And so that's where therapy comes into place. There are lots of folks who think they know how to exercise. However, they end up causing more harm than good. And so that's where I make referrals to my colleagues who are physical therapists, occupational therapists, chiropractors, and trainers, even personal trainers, and even acupuncturists when appropriate. I make my recommendations for those folks to go see them to help with that portion, which is the exercise. Again, you want to make sure that you're building the right muscles. And so, for example, low back pain, that's the most common thing I see in my practice. You want to make sure beyond strengthening your back muscles, you want to strengthen your core muscles. So your abs are very important because all of these muscles attach to your back. And so in order to strengthen and stabilize your back, you want to work on core muscles as well. So planks, ab workouts, anything you can get your hands on to do that. However, again, you can easily cause harm as well if you're not doing those sorts of exercises properly. So that's why I often make, just for a few sessions, I make my referrals to go see these therapists that can work on the back, the neck, those sorts of things. And then the last is, God forbid, if all of this stuff fails, then we have that surgery. I have my colleagues who often help me if it is something that we need to do from a surgical standpoint. And there are other mildly less invasive surgery options that I do myself that don't involve removing bone. They don't involve lots of more invasive things that some of my colleagues may do. And so I often try to tell my folks that, we're going to start with this conservative approach, multidisciplinary, again, looking at all these different buckets that we have: lifestyle, medications, therapy. And then the last thing that I failed to mention beyond all of this stuff, and which I do a majority of, is interventions, injections. These are great options for folks who have been dealing with chronic pain or even acute pain, right? Those folks that often have shooting pain down the leg, right? What happens is that you may get a disc bulge because of arthritis, because of your positioning, moving, twisting, bending, reaching for something that may cause you to irritate the nerves. And I actually have an example here, which I can show, that oftentimes, if you notice here.
A live demo, I love it.
Yes, here that my patient here, Bob is his name, he has a bleeds and caused a disc herniation, which is irritating this nerve. This nerve is responsible for pain down the leg. In this case, this is on the right side. He would often come and tell me, I have right-sided leg pain, it shoots down. Depending on which level it is, I can figure out which dermatome or which nerve root is involved, and I can appropriately treat that by doing an injection using X-ray guidance where I target that specific nerve root itself. The big thing about what I do also is folks that have back pain without any pain down their legs, it's often due to arthritis in our back. We get arthritis everywhere. We get it in our knees, shoulders, necks, everywhere. We also get it in our back as well. And the reason for that is because we have these small joints, which is bone on bone, right? And oftentimes as we get older, we get arthritis in these areas that can often cause pain. And that pain is generally localized to the back. And so I commonly do nerve blocks that help treat the arthritis that's coming from the back as well. And so there are a modality of things that we can do. There are a lot of resources. It's not just the opioids. And unfortunately, we did fall into that mindset many years ago with the push from Purdue, Johnson & Johnson, etc. However, the pendulum has turned now. We're realizing that there's so much other stuff out there. And that's why folks like myself can be a resource to my colleagues who are primary care providers to help them offload these sorts of patients that may have been dealing with this chronic pain for an extended time.
Excellent. And you have your own practice, and we should put that up there as well. So a lot of what I really liked about what you said, a couple of things that stood out to me is, one, when it comes to pain management and pain medications, there are many options that are non-narcotic. You went through quite a number of them. And then there are adjunct modalities, such as you mentioned, chiropractor, acupuncture, interventional things like injections. So it does not have to all be medications as well. There can be other things if somebody opts not to take something on a regular or daily basis. And then the other thing that I really liked is that you mentioned that the driver, right? The analogy you gave of finding out what is actually driving the pain as opposed to secondary. And that's something that I try to explain to my patients. And I think it's really important to understand is that you may have knee pain, but what is causing that knee pain? And that's the more important thing to target, because otherwise you're just putting a Band-Aid over the issue. You're treating the pain in the moment, but we're not looking at the bigger picture, what's causing it, and how do we reduce that and even maybe prevent it from going somewhere else, or reducing the risk. So for example, when it comes to arthritis, if they're overweight, talking about lifestyle things and getting them to lose a little bit of weight so it doesn't maybe shift or include their back now. They may get low back pain or other things like that. So I love that you take a more holistic approach to pain and treat it accordingly. So that's great. We do need to take a quick little break here. And when we come back, we'll continue this wonderful conversation we've been having. You're watching What's Up, Doc. I'm your host, Dr. Aalia Al-Barwani, and we'll be back after this short break.
There are 16 million children struggling with hunger in America. That's 1 in 5 daughters, sons, neighbors, and classmates who don't know where their next meal is coming from. Yet billions of pounds of good food go to waste every year. It's time we do something about it. Feeding America is a nationwide network of food banks that helps provide meals to millions of kids and families in need. Visit feedingamerica.org to help them feed even more. Together, we can solve hunger. Together, we're feeding America.
When times get dark, we can't see the help that's all around us. Let 211 be your guiding light for help with food, healthcare, and other resources.
211, how can I help you?
Call 211 or visit 211.org. 211, get connected, get help.
Right here, baby. Look. Uma.
Something more than a birthday is happening here. Once you can see it, you can help. The sooner you recognize the signs of autism, the sooner you can make a lifetime of difference for your child. Start by answering a few simple questions at screenforautism.org.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3. Dad!
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
I am what hunger looks like in America. I am an 8-year-old girl who's not excited for the last day of school. Because this may be the last time I'll have lunch.
Till September.
I am a single father of 2 who works 3 part-time jobs, and that's still not enough to put food on the table. I was created by artificial intelligence from faces of the 1 in 8 Americans who struggle with hunger.
Feeding America, 200 food banks strong.
Assalamu alaikum and welcome back to What's Up Doc. I'm Dr. Aalia Al-Barwani, and today we are talking about pain management. And joining us in that discussion is Dr. Danish Ali. So before the break, Dr. Ali, we were talking about, in general, what are the different modalities that you offer patients for treatment of pain, and we talked about different drivers for pain. And one of the things that you mentioned as a modality that you use are interventional therapies such as injections and things like that. So one of the things that I notice a lot that when I refer my patients for pain management are epidural injections and things like that. And so a lot of times patients are very hesitant to get those kind of interventional procedures because of the risk that's involved. And I think it's a good idea to maybe touch on that a little bit, because I think that there's a lot of benefit for patients that they can have a little bit of a longer benefit of pain management than with oral medications in some cases. And so I don't want people to be scared to entertain that as an option because of maybe perceived or mythical risks that may be involved. So talk to us a little bit about that, and what is that discussion with your patients? What does that look like when you offer that to your patients?
Sure. Yes. So Dr. Al-Barwani, there is a big stigma that's involved behind these sorts of injections and interventions. Oftentimes folks hear horror stories from injection went wrong, this happened to my relative, and this and that. And I want to iterate to folks is that there are many types of injections. There are many types of procedures, and just because somebody had a bad reaction or a bad outcome does not mean that that person will also sustain the same outcomes, right? And so that's one thing that I try to clear up with everybody. The other thing that's a common misconception that I see is the epidurals that folks get for pregnancy versus the epidurals that we provide for pain that folks are experiencing. And so the difference is, even though the name may be interchangeable and utilized and used into to the folks, it may seem like it's the same, but to us, it is actually different procedures. And the reason why it's different is because we use different medications. The purpose of where we're going and to what level we are going in the spine is different than it is for the epidurals when you're delivering a baby. When you have that, your whole purpose is to have no feeling in the genital, rectal, all that area, and that often gives you weakness in the legs as well. However, we are targeting a different area, a different space in your spine, and putting different medications in. So that's the first misconception that I often like to clear up for folks. The other is, anytime you get an injection, whether it be a flu shot, whether it be a muscle injection to help relieve your spasms, or you get an epidural injection, these all have risks, right? And the risks involve having a close discussion with your provider, with your physician, in terms of what are the benefits and what are the risks of a procedure. A lot of times when I have patients coming in, they're not able to live life with the pain that they're having. It may be so debilitating, they can't go to work, they can't sleep, they can't pick up their kids, they can't pray, they can't bend over or kneel to pray. Those are all things that are often life altering. And so that's where that whole risk versus benefits comes into place. We have in pain management a big array of tools that we use to make sure that we prevent any complications from happening. And one of those is an X-ray. So when the patient is receiving this procedure, they are being X-rayed consistently and continuously to make sure that we are delivering the medication in the appropriate spot. The other thing may be a contrast, which is a little material that lights up an X-ray to show us exactly where that medication is going. And so there are a whole slew of things that we do, another being a loss of resistance. And so when you are in the appropriate space for some specific injections, you will get a loss on the tube, on the epidural tube that we use, that indicates that you've reached the appropriate destination.
So lots of safety measures. Lots of safety measures. Good.
Yeah, yeah, and so, however, there are always risks for bleeding, infections, injury to nerves. But again, all of these things are mitigated by the things that we do. So we use ChloraPrep to clean that area multiple times. We're using X-ray, to make sure that we're in the right space. So there are a lot of factors that go into this, and that's why you want to make sure that you go to somebody who is trained in this. And there are, unfortunately, there are weekend courses that are being given out to folks that think that this may be something that they want to do. And I discourage that to my colleagues, to my physicians, because, this is something that you really want to make sure that you are appropriately trained, qualified in before you, attempt to go through these procedures.
Yes, 100%. There's a weekend course for anything these days. It's crazy. Right. So definitely make sure you go to someone who's board certified. That would be my recommendation as well. So let's look at some other things. You've mentioned arthritis. You've mentioned low back pain. What are some other things that you generally tend to treat? Still thinking about board certification, to treat, and what's your most common complaint, I guess, that you get?
Sure. So beyond the pains that we've discussed, I often see pain from colleagues that send to me from a cancer standpoint. So you have a tumor or a mass that's growing in different parts of your body. For example, your stomach, you've got colon cancer, pancreatic cancer, these sorts of things, because as you know, all of these organs are supplied by nerves. And so anytime there's distension, there's inflammation, there's something weird going on, the nerves flare up and the sympathetic nerve fibers start overfiring. And so what we do are common sympathetic nerve blocks to help target those specific areas and help treat that pain from whatever the source may be that's causing it. Beyond that, I see a lot of joint pain, right? Shoulder pain, knee pain. I've often had folks that have told me, especially my community members, my Muslim colleagues, who have told me that I'm not able to bend and pray, I'm not able to kneel, and so because of knee pain, shoulder pain, etc. So we can do injections to target that area as well. Lastly, the big thing I also see in my practice are headaches. Right? Headaches are a common generator of pain and are often mistreated and undertreated. And so I often have folks that I talk to about headaches that I often treat with medications, therapy, injections, those sorts of things to help them as well.
Yeah, I find that very interesting. As a primary care provider, I usually either treat my own headaches or will think to send to neurology if it's somebody with a complex migraine profile or something like that. And now you've added pain medicine to my repertoire for options. So I love that.
Yeah, so let's talk about that a little bit. So oftentimes migraines can be treated with injections. They're Botox we've seen, and this has been done for years now, and it's shown safe, effective in reducing the severity and symptoms of migraines. And so I commonly do Botox injections. The other thing that we oftentimes miss and undiagnosed, in my opinion, are headaches that come from the neck. And so I'm going to bring my friend back here, Bob. And as you can see here, Bob has the neck here, and you can oftentimes get arthritis and nerve issues that may be coming from the actual nerves in your neck. And that often may give you headaches, that may often give you shoulder pain. And so that's why it is very important to make sure that you figure out, again, going back to that analogy of the driver and the passenger, because we may be treating migraines, but we're not getting to the root of the problem, that it may be actually coming from the neck, transmitting the pain to the head, for which we are treating it with things that may be giving some temporary relief, but we may not be getting that outcome that we're looking for. Therefore, it's very important to make sure that we look at the neck, as that may be a generator, to look at the muscles that may be innervated. As you know, the trapezius muscle actually comes around and it innervates into the occiput, which is into the skull here. And that often, if you have tightening of that muscle due to posture, imbalance, in stress, those are all reasons that that muscle may be overfiring. Or even nowadays, phones, right? We're holding our phones to our necks. We're, looking at different devices. Yeah, so those are all things that we want to be cautious of, because that can help treat it. The last thing I want to mention is the occipital nerves, right? There's these two nerves that come out, and I oftentimes see folks that are complaining, that are always also complaining of pain that may be coming from the occipitals, presenting and giving you this kind of band-like headaches that they describe. I'll have patients that'll come in and kind of just basically put their hands on their head like this and say, "This is it." And then I oftentimes push right over the occipital nerves, and they jump off the table, because that has oftentimes been misdiagnosed or has not been picked up for an extended period of time.
Interesting. So those are all, when they're affecting different nerves in the cervical spine, those are all nerve blocks are helpful for that then.
Yes, that is correct. And so there are lots of different things, whether it be target the muscles, whether it be target the arthritis, or the occipital nerves, or the actual migraines itself. There are different things that we can do to help treat that.
Awesome. And lastly, before we have to wrap up, how do you address tolerance in patients? Because as you continue to do these things, patients building a tolerance is something that can happen depending on their genetic makeup and their metabolism, et cetera. How do you deal with that challenge?
So it's often challenging, as you mentioned. Yeah, the way to do that is by addressing the driver first. If you can get to the root of the problem, you can get their pain improved for an extended period of time, right? And so if we're always treating the passenger, if we're always treating something that we're not getting to the root of it, that makes it a little bit different. The other thing is always, I often tell my folks, and again, we didn't mention this, but there is appropriate patients that are appropriate candidate for short-term use of opioids, right? Whether you have cancer pain, you just broke your arm, or you've had something acute, those are appropriate candidates. And so we often have these discussions of tolerance, of taking holidays from medications, from injections, those sorts of things to help treat that and reduce the chances of becoming tolerant to whatever therapy we're offering.
Awesome. Thank you so much, Dr. Ali. This has been a great discussion. I think we jumped straight to the meat of this, and I think we gave our audience a lot of useful information. And hopefully this has shed pain management in a better light than maybe what is on TV these days. And again, we'll flash up your information on screen so that if anyone's interested in pursuing help with this, that they can reach out to you. Thank you so much for your time and for sharing your expertise with us. We wish you every success in your career.
Thank you so much, and I applaud you on what you're doing. I think this is great. Keep up the good work and keep spreading your message.
We appreciate you. Thank you for joining us on another episode of What's Up, Doc. You can watch this and all of our other episodes on our YouTube page at youtube.com/Muslim Network TV. I'm your host, Dr. Aalia Al-Barwani, and I'll see you next time on another episode of What's Up, Doc.